Welcome to Another Round, a podcast by the Pacific Research Institute. PRI is a free market think tank headquartered in San Francisco. I'm your host, Rowena Itchon. We call our podcast Another Round because PRI is just down the road from California's beautiful wine country. So stay with us to the end to find out our guest wine recommendation. We'll also reveal a secret. We'll tell you who came up with the name for our podcast. On this episode of Another Round, we have a special guest, PRI's President and CEO, Sally Pipes. And if you haven't already guessed, the topic is Obamacare and the move for a single-payer system in California. Sally's been at the helm of PRI for more than 25 years, and she's been fighting healthcare reform since the days of Hillary Care. Earlier this year, Sally and I went to Washington, D.C. on the heels of one of the biggest snowstorms of the season. We visited the senior staffs of both House Speaker Paul Ryan and Majority Leader Mitch McConnell. We were also invited to meet with Tom Price, the new Secretary of Health and Human Services. While admitting that passing a repeal and replacement for Obamacare wasn't going to be easy, they were pretty confident it was going to get done. We both left Washington feeling very optimistic. But winter turned into spring, and now it's been a very long summer for Sally, and still no repeal and replacement for Obamacare. Here's Sally to bring us up to date.
Ro, it hasn't been a long summer. It's been a long 7 years and almost 5 months that we've been working on this. And, you know, the American people elected President Trump and a Republican Senate and House because they voted in favor of repeal and replacement of Obamacare. And, of course, as you just mentioned, this has not happened, and we're in the middle of a giant mess. Yes, I met with you. I met Dr. Tom Price, Secretary of HHS, fairly new in the job at the time, and we met with other important members of the Republican Party in the Senate and the House. Everyone was very optimistic that Obamacare would be repealed and replaced. March 23rd marked the anniversary of Obamacare, so this was just about a week before the vote was going to take place. And fortunately, the American Health Care Act, the House bill, did pass 217 to 213, but since that time, the Senate bills that have come forward have not passed. And the most recent, the skinny bill, or what we call really the Health Care Reform Act, went down 51 to 49, with Senator John McCain voting against that bill.
What do you make of this bipartisan effort now?
Bipartisan seems to be the word of the day. Senator Lamar Alexander from Tennessee and Senator Patty Murray from Washington, D.C., who's a Democrat, they say that they will be holding hearings starting right after Labor Day, hearings on the Senate Health Committee, that's Health, Education, Labor, and Pensions Committee, to see if they can come up with a bipartisan bill that might be amenable to both parties and may be able to pass. I'm not against the idea of bipartisanship, but I really think in the area of health care, it's going to be very, very difficult to get a bipartisan bill that if the Democrats agree to it, that the Republicans would ever agree to it, because they have a different philosophy on what is the role of government in our healthcare system.
And yet, Sally, Obamacare continues on its death spiral. Premiums continue to rise. Insurers are pulling out of the market. What do you recommend to Congress that we ought to do?
Well, I mean, this is true, but premiums rising, high deductibles, the average deductible for a family who purchases a bronze plan today, that's over $12,000. So while many of these people have insurance under Obamacare, they can't afford to use it when they have to pay $12,000 before their insurance kicks in. So this is something that is serious. Obamacare, as President Trump has said over and over again, it's a disaster. It's in a death spiral. He hopes it will implode. But, you know, on the whole issue of where is this going, I mean, my thought is when the Republicans promised the American people that the law would be repealed and replaced, they really should be working hard to do what the American people wanted. And this could have been done. And I think one of the big issues was shortly after the inauguration of President Trump in January, he should have sat down with his key Senator McConnell, Speaker Paul Ryan, Dr. Tom Price, and a number of key people in this debate, and come up with a strategy of how they could do a repeal and replacement plan. Dr. Price's plan was a very, very good plan. And then Paul Ryan had a plan. It wasn't really a legislative plan, but it was a white paper called A Better Way. And both of those plans were very good, and actually would have dealt with the issue of how to repeal and replace Obamacare. Many people said the problem is we're in this mess because the Republicans never had a plan. In fact, the Republicans had too many plans. They couldn't agree on what was the right plan. But those plans, the plans from Tom Price and Paul Ryan, were very good plans and actually fit in well with my book, The Way Out of Obamacare. This is what they should have done. They should have worked it out instead of fighting like cats in a laundry bag when they're actually, in session and everybody is arguing and they can't agree. There was so much dissension over the Medicaid expansion plan, which is very expensive and is not working for people in those 31 states that expanded their Medicaid plans, the high premiums, the high deductibles. Another big issue was the very small networks of doctors and hospitals, which people, when they bought an exchange plan, thought they would be able to keep the doctor and hospital they had used before, and that would just happen not to be the case because insurers found they had to limit the size and network of these networks because they were spending too much money and their claims were more expensive than what they were bringing in the premiums. So it's a real mess. Another big issue, of course, between the Republicans and the Democrats, but not just between Republicans and Democrats, but between those Republicans that are more to the left and the center than those on the right. We're really upset about the whole issue of pre-existing conditions and how would a new law deal with those people with pre-existing conditions. And I think there's a lot of misinformation out there about who is the population of people who have pre-existing conditions. And in fact, it's very small. It's probably about 6 million people. And we only have about 10 million people on those exchanges. We have upset the whole healthcare system in this country for about 10 million people. And it's really a catastrophe. The American people want a healthcare plan that empowers doctors and patients, not the federal government. And we are definitely on a huge path to empowering at a greater degree the federal government.
Sally, given the rancorous political environment in Washington now, you've got the free marketeers on one side, you've got the moderates, you've got the Democrats, what do you think the 3 or 4 pieces of reform that could potentially get passed in Congress that they should focus on in the fall?
Well, with all of the Senate bills going down to defeat, I think one of the things that they need to look at is what can be done administratively through Dr. Tom Price in his office, and what can be done through executive action. And there are a number of things that can be done. One would be to reduce the time that people could sign up for these special enrollment periods, and people need to prove what their problem is, not just because there was a lot of fraud there. They need to change the medical loss ratio where small insurers would have to could only charge 15% for administrative and 85% for what they pay out in claims. There's many things, the essential health benefit plan, the 10 mandates that an insurance company on exchange has to provide. All of these things add cost, but a lot of these things could be done through administrative action. Some things can be done through executive action. After all, remember this whole issue that's going on right now about whether the cost sharing reduction plan subsidies should be paid out to insurers, $7 billion a year, for that segment of the low-income population earning between 138 and 250% of the federal poverty level for silver plans. These people, the insurers are getting about $7 billion a year. Those funds were never appropriated by Congress, and yet President Obama took one of his administrative knives and said, we're going to pay these subsidies out anyway. It's a huge contentious issue. But I'm hoping, President Trump has said many times that he's going to end the CSR payments. I don't know the Congressional Budget Office has costed this out if they were discontinued, saying that premiums would go up 20%. I just don't really think that's the big issue. I think the big issue is the big push behind increased premiums is really community rating and guaranteed issue. Guaranteed issue means that anyone who applies for a healthcare insurance plan has to be given one. And community rating means an insurer cannot charge different rates based on age or your health status. So I think a lot can be done there. I also think there's room to, in the fall, introduce some component bills that would be individual bills that could look at repealing the individual mandate, the employer mandate, getting rid of some of the taxes, like the medical device tax, the HIT tax, the health insurance tax. A number of these things could be introduced in independent bills, component parts of Obamacare, and could be be eliminated.
There's also a big issue in Congress right now that apparently the members of Congress found a loophole in Obamacare, and they and their staffs are receiving subsidies. What do you make of that? And you would think that at a minimum, the Congress would try to repeal that.
The federal government employees and members of Congress getting these subsidies for them to purchase health coverage on the SHOP exchange. That's the small business exchange, which was set up for firms with fewer than 50 employees. And members of Congress can buy coverage on the DC SHOP exchange, and they're getting a subsidy for it. The whole idea of Obamacare was that would not be the case. So we have two issues that are really rampant right now. One is the continuation of the cost sharing reduction mandates, subsidies, and the other is giving subsidies to members of Congress to help them purchase coverage in the SHOP exchange. And it should be, these things should be ended as soon as possible.
Well, Sally, as you know, here in California, your old friend single payer has once again reared its ugly head. Senate Bill 562 has probably become really one of the most high-profile and certainly controversial bills to be considered in many years. I know you've had a chance to study the proposal. What do you think the impact of SB 562 would have on the healthcare of Californians if it became law?
Well, I think, Tim, we have to first look back. It's not just in California that single payer is, on the radar right now, but in Vermont, Bernie Sanders' state, Governor Shumlin signed a single payer bill into law several years ago. And when they went to, bring it actually into being, he found that the tax increases would be so significant for the people of Vermont that he had to shelve it because it wouldn't be affordable. We also saw in last November's election, Colorado had an Amendment 69 on the ballot, which was a single payer initiative. Even the Democratic governor, John Hickenlooper, wouldn't support it, and it went down to defeat, very, very, very handily down to defeat. We're now seeing, in addition to California, we're seeing Washington State, Michigan looking at single payer. And then, of course, Bernie Sanders, at the federal level, won't give up on his rostrum of talking about single payer, and now he says that he will be introducing a single payer Medicare for all bill in September. He doesn't think it will pass, but he wants to get things going. And then a survey came out just recently showing that doctors, physicians, are now more supportive of single payer healthcare than they ever have been. So I wish people would read the material that is written on single payer. I'm a Canadian. I grew up under single payer. When government sets the budget for what can be spent on healthcare and they have to keep it under control, three things happen. You have long waiting lists for care is rationed, and you have lack of access to the latest technology. So in a country like Canada today, the average wait from seeing a primary care doctor getting treatment by a specialist is 20 weeks. That is over 5 months, and that is double the number that it was in 1993. So even with a conservative government in power for many years, Canada was not able to get rid of its single payer system. People that have to use the system and need a specialist, they hate it. But when you give people something, as Milton Friedman said, you give people an entitlement, even if it's not working, very hard to take away. And of course, we see the same thing in England under the National Health Service, people being denied care. The latest NHS initiative is that people who are deemed obese and have a certain BMI, body mass index number, that they will have to wait at least a year to get an appointment with a doctor or a specialist because they are obese. So single payer is really meaning there is one payer government, no private health coverage. The real issue is these programs end up being very, very costly. That California single payer initiative, the Healthy California Act, was costed out by the Senate Appropriations Committee at $400 billion a year. That's more than double the cost of the whole budget of the state of California. So what you're going to see is that care will be rationed, long waiting lists, doctors will become union members, their salaries will be set by the state government. So what does it mean for patients? It means many doctors will retire early. Many doctors would leave California and go and practice medicine in Arizona or in Nevada. So we will have a shortage of doctors. And the best students graduating from medical schools, many of them come to practice in California. Well, they are going to strike California off their list. So SB 562, which passed the California Senate on June the 1st, was actually parked in the Rules Committee by Assembly Democratic Assembly Speaker Anthony Rendon, and he is being just trashed by the nurses' unions. He's actually even getting death threats for parking that bill and not bringing it to a vote. But as we know, California has a 2-year legislative session, and it wouldn't surprise me, after all the pressure on Rendon, if they don't bring it back later this year or early next year in the second year of the session. But how would it be paid for? That was the thing that Mr. Rendon said. He just couldn't see where the money would come from. It would mean very major increases in payroll taxes and in income taxes for the people of California.
Sally, for our listeners who may not be as familiar with your work, you're probably the number one opponent of single payer in California, and you've been battling this successfully since back in the early 90s when there was a statewide ballot measure on single payer that you helped to defeat. And you've been very busy on SB 562 this year. Your op-ed that you had in the Wall Street Journal the day after the bill passed the Senate generated a lot of buzz. You've been debating Senator De Leon and the Michael Leidy from the Nurses Association in very high-profile debates. And then you just mentioned the political trouble that Speaker Rendon has gotten into. And I think what really has separated the debate this year has been really the bullying tactic and the aggressive political tactics of the nurses union. So I was wondering if you could kind of give your thoughts on how the political debate has shaped up on the single payer bill this year as compared to other years when you've been fighting it. And then, what do you think down the road? Do you think single payer is inevitable in this political climate in California?
Well, I think, today it has become, as you say, Tim, it's very political. I think that California Senators Ricardo Lara and Tony Atkins, I think they brought this bill up because they were pressured by the nurses union for single payer. And I can't understand why the nurses have become so strident in pushing for single payer. Nurses in California are very well paid. So I don't know why they're pushing so much for this, because every example around the world of a true single payer system, whether it's Cuba, North Korea, or Canada, Britain has a two-tier system. It does not work, and patients are harmed. But for some reason, the nurses union has been able to push these Democratic senators to a total government-run healthcare system. And when you look at SB 562, it's even more of a single-payer system than in Canada, where we have these long waiting lists that we talked about. It includes the fact that no one would need a referral to see a specialist, which of course you do in Canada. That's where the waits are. Eye coverage would be included, dental coverage, prescription drugs, many things that aren't included in the Canadian healthcare system were part of this. So when the Senate Appropriations Committee said this would cost $400 billion a year, a professor at the University of Massachusetts, Amherst, said it was around $300 billion. It's still very, very expensive. And what will happen is, just like in every other country, there will be long waiting lists because government won't be able to afford to provide all the care that people demand. So that's very important. I think as we're seeing more and more around the country the call for single payer, Charles Krauthammer came out a couple of months ago and said he expects to see a single payer healthcare system in the United States, i.e. no private coverage, within 7 years. And I thought he was just, whistling through the wind. But the more I see what is going on and the more I hear this debated and the more the Republicans have not been able to get a real repeal and replacement bill through and passed as promised, this is definitely something that could happen, and it would be a disaster for all of us in America. And I like to say, if we get single payer here, there will be no off-ramp, as Hayek said in his book, The Road to Serfdom. And where will we go? Where will we go? Canadians come here, Brits come here to get the kinds of tests and healthcare that they feel that the waiting list is too long. So my idea is I'm going to, with Rowena, buy up a bunch of Liberty ships, and we're going to get all the best doctors, and people will be able to go on a Liberty ship and get the kind of healthcare that we in America are used to.
Well, I might have to buy a ticket to your Liberty ship if single payer becomes reality in California. Sally, I want to shift gears a little bit and talk about Covered California, which for our listeners is California's Obamacare exchange. And they recently announced that consumers are going to see average premium increases of about 12.5% in 2018. And actually, some regions of California are going to see far greater premium increases. Liberals and Obamacare proponents always talk about Covered California as kind of their model for a healthcare exchange that's working, but I don't think these figures really show that. So what do you think these premium increases portend for the future of Covered California?
Well, I think Covered California, as you say, is often touted as being the exchange that actually has worked. Several exchanges, of course, have shut down, state exchanges, and these states have joined healthcare.gov, the federal exchange. And then in the law, under Obamacare, there were these co-ops that were set up because the public option never made it through, which would be a government insurer competing in the exchange. That didn't get into the final bill, so they allowed these co-ops to be set up. 19 out of 23 have already failed and have shut down, leaving people without coverage. So Covered California, I think there aren't that many people. I think they're on Covered California. The interesting thing is it's not, I think there are about 3 million people on Covered California. The other thing that is interesting is that Medi-Cal, which is the state version of Medicaid, we have 1/3 of our population on Medi-Cal, so about 13 million out of 39 million Californians are on a program designed for low-income people. And the issue is California was one of the states, of course, that took the extended funding for the Medicaid expansion program. And what we're seeing in this state is a very high percentage of people who are now covered on Medi-Cal are using emergency rooms because they can't find doctors who will take them as patients. And the reason that the doctors won't take them is that they are paid so little money in reimbursement for treating Medi-Cal patients. So between Covered California and this huge expansion of Medi-Cal, I mean, I think it's a shame that 1/3 of our population is on the program Medi-Cal.
Sally, the other big healthcare news in California was Anthem Blue Cross's recent announcement that they're going to be pulling out of 16 of the 19 pricing regions in California. What impact do you think this announcement will have on the ability of people to get healthcare in California? And what does this announcement say about how well Obamacare is working even in liberal states that have gone all in like California?
Well, Anthem's pulling out, as you say, 16 out of 19 regions. Some regions have slightly lower increases than that average 12.5% that you mentioned. In fact, if the cost-sharing reduction subsidies end, Peter Lee says that the increase will probably double. It'll be another 12.5% to the premium increase in this state. But the real issue is that with Anthem pulling out, it's not just Anthem pulling out this year. Many of the insurers have been pulling out of the exchanges, healthcare.gov and other state exchanges in the last couple of years because they are losing a lot of money on their exchange customers because the people that are sick are using a lot more coverage than they hoped the young people would be in the exchange to cover. Obama had said that they expected 40% of the exchange business to be people, the young invincibles, people between 18 and 34. In fact, the number is only 28%. So the insurers are losing money on those people who are sick. And so Aetna, Humana, United, they've been getting out of the markets. And in fact, Aetna and Humana aren't going to be in any exchange markets next year. And this wasn't surprising that Anthem would get out of a number of the regions in California. It's all part of the failure of Obamacare.
Sally, what do you think about Trump's plan to just let Obamacare implode?
Well, a lot of people are very upset, and the president has been, taking shots at Dr. Tom Price, Secretary of HHS, and Senator Mitch McConnell, saying, that they just didn't do their job. And then, of course, he says many times that he's very disappointed and he thinks Obamacare should implode. And in fact, I think that might be the way to go. I just don't see how doing a repair or a fix to Obamacare, which there's a lot of talk about now. I think if we do it a repair or a fix, that means that as time goes on, Obamacare will be strengthened, not weakened, and that's another path towards a single-payer Medicare for all system. And I want to add that I think President Obama's real plan for the American healthcare system was a single-payer Medicare for all system. He wanted to start with Obamacare, the Patient Protection and Affordable Care Act. It was bound not to work. And then people can say on the left, well, we tried Obamacare, we tried a market plan and it didn't work. Of course, it wasn't a market plan, but then it opens up that whole debate to single-payer Medicare for all. And even increasingly, people are talking about Medicaid for all. And since Medicaid is more of a failure than Medicare, I think this is really a frightening way to end our conversation.
Sally, given that ominous news, we've all shared a bottle many, many years, especially over the last 7 years of Obamacare. So tell our listeners what your favorite rosé is.
I used to be a white wine drinker, but I don't know, I somehow got off white wine and onto rosé. And so in our wine cellar at home, we have many, many bottles of different kinds of French rosés, Spanish rosés, Italian rosés, and California rosés. But I have to say, my favorite rosé today is Miraval, the rosé wine that was developed by Brad Pitt and Angelina Jolie. I don't know what's going to happen to Miraval since it seems that they have parted company, but I hope the Miraval winery in France will continue so that I can continue to enjoy my Miraval.
I should also say that it was actually Charles Kessler, Sally's husband, who gave us the idea for the name of our podcast, Another Round. Charles is editor of the Claremont Review and political science professor at Claremont McKenna. So this toast at the end of our podcast is to Charles. Thanks very much, Charles.
Thank you, Rowena. Thank you, Tim.
Thanks again to our guests, Sally Pipes, and of course, Tim Anaya. To stay up to date with PRI, visit our brand new website at pacificresearch.org. And mark your calendars for PRI's annual gala on November 1st, 2017. Our keynote speaker is Silicon Valley entrepreneur Peter Thiel. If you like this episode, please tell your friends and subscribe to Another Round with PRI at iTunes, Google Play, Stitcher, and TuneIn. And do us a favor and leave us positive feedback and give us 5 stars. You can also listen to our podcast at PRI's YouTube page, youtube.com/PacificResearch1. That's the number 1. Thanks again for listening. Until next time, I'm Rowena Itchon. We hope you'll come back again for Another Round with PRI.